You should see a little message popping up on your window soon.
That about the recording? Yes.
Yep, I see that.
Yeah, I see it.
You should see a little message popping up on your window soon. All right, we are ready. Good afternoon, everyone. All right, I want to thank you guys for joining us on our community conversations. This afternoon, well, first, let me introduce myself. My name is Craig Brandon, and I'm the Vice President of the Jamaican American Connection. And with me this morning, I have Dr. Tanisha Grant. She is a board certified gastroenterologist who practices in New Haven, Connecticut. She has been in practice for 13 years and treats adults with a wide range of intestinal conditions, ranging from acid reflux to constipation, and is a strong advocate for colorectal cancer prevention. Also with me, I have the special guest of Dr. Yoon Hee Chang. She attended Albert Einstein College of Medicine in Bronx, New York, completed a residency in internal medicine at Yale University School of Medicine, and a fellowship in clinical sleep medicine at the University of Pennsylvania. She is a board certified sleep physician who specializes in treating a wide range of sleep disorders, including sleep apnea and insomnia. She is currently at Evergreen Health Sleep Disorders Center in Kirkland, Washington State, helping patients get the restful, restorative sleep they deserve. Thank you all for joining us for the Sandman Secret: Unlocking Your Best Sleep. Dr. Grant, I turn it over to you.
Thank you, Craig. And I could not be more honored and more excited to kick off this year's community conversation series with none other than my long-term friend, Dr. Yoon Hee Chang, who is so accomplished, as you just heard Craig say. And I'm so honored to have you on today, Yoon Hee. Thank you so much for joining us.
Thank you so much for this wonderful opportunity, Dr. Grant, and thank you so much for the wonderful introduction.
Oh, you're very welcome. So I have to admit that I had some personal stake in choosing today's topic of conversation because as I've gotten older, I've been having a little bit more trouble sleeping and finding that sleep has become a challenge. And I've spoken to lots of friends of mine who also have similar issues getting restful sleep. And I'm like, who should I talk to about this? And you were the first person who came to mind. And I
Thank you.
thought, it would be a nice opportunity to kind of pick your brain and get your expertise on ways that we can just improve sleep quality. Because as you know, sleep is so vital to overall health, and poor sleep has so many negative consequences. So, so I just wanted to give that little background about why I chose this topic.
Great, thank you.
So, can you start off by telling us exactly what a sleep specialist does? I don't think a lot of people are familiar with a sleep specialist. Exactly what do you do?
Yeah, so a sleep specialist is a doctor who has received extra training and many times a new fellowship to help treat various sleep conditions like sleep apnea, insomnia, also treating conditions like restless legs, narcolepsy, sleepwalking, various conditions as those.
Okay. And what made you interested in this specialty?
Oh, because sleep is a very important aspect of life. And when I worked as a internal medicine physician, mainly taking care of patients who got admitted to the hospital. And when I was there, I took care of a lot of patients who got hospitalized because of sleep apnea related complications. So patients would come in because of having all of a sudden a heart attack or stroke, and they didn't have a lot of other health risks other than maybe obesity, and they were quite young. And many of them actually had a lot of symptoms to suggest that they had sleep apnea. They were snoring and having pauses in the breathing, and they were noticeably not breathing when they're sleeping. And also, I noticed that the patients were not able to sleep very well when they're in the hospital.
Mhm.
So that led me to look into, I really want to help these patients to prevent these illnesses from happening so that we can reduce those patients' risk of having to come to the hospital of those health complications. So that
Oh,
led me to switch gears.
yeah. So poor sleep can literally be deadly.
Yes, it
What I'm
can
hearing
be.
you say,
Yes.
which is so unfortunate. So
Yes.
I think a lot of people kind of associate, sleep apnea with snoring and having to like nudge their partners in the middle of the night to get them to wake up so that they can stop snoring. Can you tell us a little bit more about exactly what sleep apnea is? And I'm sure everything is on a spectrum, but is it always as severe to, significantly increasing the risk of strokes and heart disease? Or how can we try to intervene on sleep apnea early on so that we can prevent the complications like the ones you mentioned?
Yeah, so one of the main symptoms of sleep apnea is snoring. And the symptoms can vary quite a bit depending on the person. And so the more obvious symptoms tend to be snoring, and you might sound like you're not breathing right when you're asleep. So you might be pausing, you're having pauses in your breathing, or all of a sudden you're snoring and you go silent, and the partner tends to elbow the the person to make sure that they're breathing, or come on, start breathing. But interestingly, for women, the symptoms might not be very obvious, because the one of the more obvious symptoms of sleep apnea tends to be you're waking up gasping for air, or during daytime you might be very, very sleepy. But for women, it can be snoring and just having poor quality of sleep during the night. You might not be waking up gasping, and during the day, you might be just feeling tired as opposed to falling asleep unintentionally. So it really varies. But one of the main symptoms that you might want to start thinking about whether you have sleep apnea or not is if you're snoring at night and the quality of sleep at night is not very good.
Okay. So do all persons who snore have sleep apnea? Are those
No.
two things synonymous?
No, not necessarily. So snoring happens when the air travels from a wide space to narrow space, and it creates turbulence. And so when a person breathes in air, if there's a lot of narrowing of the airway, then that turbulence gets created, shakes up the soft tissue, like the tongue base or the soft palate, and that's what snoring is. Sleep apnea is going one step further. So when the airway gets narrower, and that now you're not getting enough air and your oxygen starts to drop, or if the airway gets completely blocked when the tongue falls back and closes your airway, then, and when that happens multiple times throughout the night, that's what sleep apnea is. So it's not unusual to snore and not have sleep apnea, but it's a bit unusual to have sleep apnea without snoring.
I see. Important distinction to make.
Mhm.
So, other causes of snoring, based on what you're telling me, could include things like nasal congestion, which you can get from a common cold or any upper respiratory infection. Um, is a deviated septum a risk for snoring as well?
Oh, yes,
Yeah,
yes.
right.
Yeah.
So anything that kind of narrows the turbinates and reduces the passage of air normally can potentially cause that turbulence that then produces the abnormal sound, which is snoring.
Exactly. So the sleep apnea tends to happen because blockage of the airway, and that can occur in multiple levels. So
Okay.
highest it could be at the nasal passageway, and also it could be related to the soft palate, or the uvula, or the base of the tongue, or the side walls, in the airway. So it can be multiple levels. So
Right.
yeah, because of that, nasal congestion definitely can contribute to the snoring, if you have smaller airway or bigger tongue.
Right.
Also, the neck tends to be a little bit thicker. That can also contribute to that. And also your jaw size or jaw positioning can contribute to that as well.
Ah, but I guess one of the most important things, as we tell all our patients with any medical condition, is that if something is chronic, then it's more likely to be pathological as opposed to something just being, temporary and happening every once in a while. So I think the big takeaway here from what I'm hearing is that if you're a chronic snorer, then, you should probably seek medical attention to get evaluated for
Right.
sleep apnea, right?
Yes.
Okay.
And also, sleep apnea can occur even when you're not obese.
Yeah, I heard that actually. Yeah, so even in thin people.
Yes. So
Yeah.
it really depends on the airway size and jaw positioning. So the traditionally are the most common forms of sleep apnea we see when patients are obese. But I do have a lot of patients who are very slender and they still have sleep apnea. So if you're snoring and you have your sleep quality is not the best, you feel tired during the day, or if you have other health conditions like heart disease or blood pressure problem, memory problem, even diabetes, it would be worth talking to your doctor about it.
Okay. So from what I understand with obesity, sleep apnea is more common in obese persons because there's a lot of redundant soft tissue in the neck area, and that soft tissue tends to collapse when they're sleeping and obstructs the airway.
Exactly.
But even if you don't have a lot of redundant soft tissue in the neck area, which can happen in obesity, you can still have sleep apnea as a normal sized person because of other anatomical defects in the upper respiratory tract, right?
Yes, that's absolutely.
Okay. So I have patients who come in to see me for non-sleep related issues, and then I'll go over their medical history. And I see sleep apnea as listed as one of their medical problems. And right next to that diagnosis, they'll have in parentheses, not using CPAP. And I almost don't even have to ask them why they're not using CPAP. And so I guess,
Yeah.
we can just use this as a little bit of a segue into talking to our audience about some of the treatments for sleep apnea and
Mhm.
why CPAP machines have become so notorious. So let's talk about that a little bit, please.
Yeah, so well, CPAP has been around the longest to treat sleep apnea. And just for the audience who are not familiar what CPAP is, it's a machine that provides continuous positive airway pressure to your airway. So kind of like when you have a flat tire, let's say your bicycle tire that's flat, you pump air, you open it up. It's similar in concept that way. So sleep apnea occurs when your airway collapses while you're sleeping. So this machine is giving you pressurized air to keep your airway open. Of course, since the machine is doing its job, you got to wear a mask so that you can get the air in. Um, and you can imagine while you're wearing a mask to sleep, having something on your face
Not
that's
very
giving you
sexy.
pressurized air. And of course, on TV, and you see all these masks that look like Darth Vader masks. And so it's gotten a pretty bad rap. But
Is there an alternative to that?
yes, so
Yes.
there are alternatives. So CPAP is definitely the most effective treatment out of all of them, even when it has that like discomfort or negative connotation to it. So there is a reason that sleep doctors really recommend CPAP over other ones. But depending on the severity of sleep apnea and your underlying health conditions, there are other options. There is a dental device that can be used that almost looks like a night guard,
Hmm.
and that is designed to adjust your jaw position a little bit forward so that when you're asleep, it'll keep your airway open.
Oh,
So
okay.
it's kind of like when you try to snore or mimic snoring, when you pull your jaw back, it's quite easy to snore. But then when
Okay.
you pull your jaw forward and try to snore, it gets actually pretty hard. So it's that concept.
Ah, that sounds amazing.
Yeah. So there's the dental device. There is what's called a intraoral neuromuscular stimulator device, mouthful. but it's a commercial. I don't know if we're allowed to say commercial names here, but there's a device that stimulates the tongue muscle. And you use that during the day to strengthen it up so that when you're asleep, you don't use any other equipment, but it will help to strengthen the muscles so that when you're asleep, your tongue will stay toned and wouldn't close the airway. So there's one option
Oh, I
there.
see. So
And yeah, so there's that.
exercise to improve the
Exercise,
tone.
yes. There's
Right.
also myofunctional therapy specifically for tongue that you can
Okay.
do. Yeah, there's that.
Very interesting.
Yeah, and also upper airway surgeries and implants. So there's a lot of options. And also lately or recently there was a FDA approval of a medication that's designed to help with sleep apnea as well.
Okay.
Very new. So that's another option, but that one probably it would need to be done in conjunction with other therapies. But yeah, it's actually a very exciting time for a sleep field right
It
now.
sounds amazing. And I can't wait to go back and tell my patients that they don't have to wear the CPAP mask that's expensive. So I'm
That they
still
have
happy
other
with the
options.
options. Yeah. And the other exciting thing is that many, many years ago, sleep apnea was only formally diagnosed in a sleep lab with an
Yes.
overnight sleep study. But
Mhm.
now sleep apnea can actually be diagnosed at home, right?
Yes.
Which is also like really, really convenient for the patients. And, they're more likely to have an official diagnosis and receive proper therapy.
Yes,
Not
absolutely.
just not to, annoy their bed partner, but also
Right.
to literally save their lives, which is
Yeah.
which is incredible.
Yes, absolutely. Absolutely. Yeah, I've had a lot of patients who really were hesitant on getting sleep evaluation because they have heard about, oh, I have to sleep in a lab with all the wires attached to me. How am I gonna do it? Or some of the patients who's already had that experience say like, oh, I'm never doing that again.
Yeah.
But yes, we absolutely have home testing options that are simpler and you can sleep in your own comfortable bed and yes, in your own sleep schedule. So yes, absolutely.
Right. And probably also more likely to get more accurate results, right? If you're doing these tests under more normal conditions and the comfort of your own home, as opposed
Yes.
to going into a more artificial environment, I would imagine, right?
Right.
Yeah.
So, yeah, degradation of sleep quality is definitely a concern when doing the study in the lab. The home testing, yes, patients do tend to get better sleep.
Yeah.
And but I mean, there are some nuances about the home testing that sometimes it might miss a sleep apnea diagnosis if the quality of sleep is really, really poor.
Hmm.
Because I mean, the sleep study, you got to be able to sleep for us to get
Right.
the results. So if you're not able to sleep, that can affect that. But overall, in general, patients tend to like the home testing because I mean, they sleep better at home than in a uncomfortable, like a different environment.
Okay. And I know it's always a little challenging to answer. This might be challenging. This might be a challenging question to answer because I know it's so individual. But is the home testing routinely covered by insurance? Or I guess it depends on commercial versus private insurance or commercial versus government insurance rather.
Exactly. So, routinely, usually the home testing tends to be covered,
Okay.
as long as you have appropriate diagnosis. It actually, might be, easier to have the home testing covered as opposed to the in-lab sleep study.
Oh, good.
Yeah, so I mean there are still conditions and situations that we still have to do the lab study in a lab,
Okay.
but most of the insurances they tend to cover the home testing.
Okay, good. I'm very
Yeah.
happy to hear that. Okay, so that was a wonderful overview of sleep apnea. Let's move on and talk about insomnia,
Mm.
which has been something that I've been struggling with of late. And I have what's called terminal, I'm diagnosing myself, but I have what I think is terminal insomnia, meaning that I fall asleep very easily, but I tend to wake up in the middle of the night, or I tend to wake up before my alarm clock goes off, and then I have a difficult time falling back asleep. So, and it really, really affects my overall quality of life, as you can imagine. And it just seems so inefficient to be in bed for 6 or 7 hours and to have only slept a small fraction of that amount of time. So I wake up the next morning and I'm thinking I'm tired, but I can't go back to bed because I need to get to work because of the time, but I'm not rested. But yet I felt like I wasted the night, being unproductive in terms of sleep. And it's so distressing. It affects my mood. I'm
Yes.
not, I'm a little bit more irritable. It throws off my diet, it throws off my exercise routine. And I know so many people struggle with not just terminal insomnia but with other types of insomnia. So I am hoping that you'll be able to shed some light and give us some of those Sandman secrets about how to best cope and manage insomnia. So what are your thoughts, please?
Yeah, so you really touched upon pretty much most of the classic insomnia symptoms. So, insomnia is categorized either as acute or chronic. And if it's been going on for at least 3 months, we say it's chronic insomnia. And mainly, what insomnia is, it's trouble either falling asleep, staying asleep, or waking up way too early than what you would like to do. And also that disrupted sleep is affecting how you're functioning during the day. If it's affecting your mood, your ability to concentrate, and also when you're sleep deprived, it can affect the your diet, as in it'll increase your sweet cravings, or you would be craving more for like fried or unhealthier foods. So it can definitely affect you in so many ways. And when you're not sleeping well, it can really affect you look tired and your memory can suffer. And in the long term, it really can also affect your cognition and potentially increase your risk of having dementia later on. So it's really important to address insomnia when you're having the symptoms. Um, the a lot of the times when you're not able to sleep very well as such, many times stress plays a large role.
Yeah.
Uh, uh, Especially terminal insomnia, those are notorious for causing or caused by a lot of stress. You wake up and you start thinking about work and
Yeah.
stressing out. Also, underlying circadian rhythm changes can be affecting it. So if somebody has what's called a delayed sleep phase, that's when you're a night owl, then falling asleep is a challenge. Also, if you're a morning lark, then waking up later is a challenge. Uh, and then also there are people who are in between. Also, if you're drinking alcohol, caffeine, those can affect your sleep, and your ability to sleep as well as how much you're looking at your electronic devices, like your phone. Mm-hmm. Yeah.
Aha.
And also for professionals who are so busy,
Right.
sometimes we have patients have what's called a revenge bedtime procrastinations.
Ah.
What that is during the day and even into the evenings, you're so busy, you're working, you're taking care of the family. And then finally, you only have that 1 hour, just half an hour at night when you get to bed that you have time for yourself. And so patients tend to do all the stuff that they were kind of putting off for the day, like looking at their phones, emails, checking social media, or doing the last minute stuff that they want to do. So all of those can contribute. And of course, like health conditions like sleep apnea can disrupt your sleep as well
Right.
as legs, etc. Yeah.
So terminal insomnia, I didn't define that before, and I think Dr. Chang did. But terminal insomnia is just basically you have no trouble falling asleep, you're just waking up um,
Earlier.
earlier
Yes,
than
in the
planned or
exact.
earlier than necessary. Okay. So is there anything? I have gotten a new mattress.
Mm-hmm.
I turned down my temperature to 68 degrees at night.
Mm-hmm.
I try to have a very consistent sleep schedule where I try, I mean, I know all the things that I'm supposed to be doing. It's just that sometimes it's hard to stick with a routine because there are just not enough hours in the day sometimes. That's how it feels, especially with our busy lives, with all the busy lives that each of us, have. Um, but I've gotten the mattress, I got the curtains, the blackout curtains. I turned on the temperature to 68, and I tried not to eat within 2 hours of bedtime. I tried to avoid alcohol in the evenings. I mean, I'm sure the treatment is different for each person, right? And it depends on what the underlying etiology of the sleep issues is. But what advice do you have for us in terms of minimizing this issue?
Yeah, so you really touched upon a very important point about having good sleep. One is making sure the bedroom environment or you're creating adequate environment for sleep. So it has to be dark, it has to
Right,
be quiet, and it has to be cool.
right,
Um, and also you're minimizing anything that can disrupt the quality of sleep. Fantastic. Uh,
right.
the other aspect that you might also want to focus on is not forcing sleep.
Yeah.
And in terms of keeping a set sleep schedule, you kind of have to listen to your body. So let's say you want to sleep from 10 to 6, 10 p.m. to 6 a.m. But right now you're having a hard time, for example, in your case, trouble sleeping past, let's say example, 4 a.m.
Yeah.
And so if you're up at 4 and you're in bed struggling to sleep until 6, what happens is that your brain starts to associate the bed as a place of struggle from 4 o'clock and on.
Hmm.
So when you wake up, your brain thinks, oh, it's 4 o'clock, I'm in bed. Okay, this is time for me to stress out about sleep. And
Ah,
so, yes. So, and what happens is
it
that
literally creates a vicious cycle.
exactly,
Oh
exactly.
no.
Yeah, so when you're struggling to sleep, when you're stressing out about sleep, that really counteracts your ability to sleep because stress is
How
a
can you
survival
not? How can
mechanism.
you not? How can you not get stressed about it?
Yeah, so I know it's very, very hard, but I mean, you're supposed to stress out to survive. I mean, human beings, if stress is something, it's a
It keeps
survival
us alive,
mechanism,
right?
right? Yeah. So if you are, let's say, getting chased by a saber-toothed tiger and stressed out and you fall asleep, you get eaten. So
But
stress is
you
supposed to
can't
keep
be
you
in
awake.
fight, but you can't be in fight or flight mode when you're trying to rest and digest.
Exactly.
Which are the sympathetic versus parasympathetic nervous systems and their respective functions. But yeah, sorry to interrupt. Go ahead.
No, 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 no. Like that's exactly what it is. So what you would need to do is when you're noticing that you're struggling to sleep, whether it be just 5 minutes after you wake up or 30 minutes after you wake up, you want to kind of come out of bed and do something that helps you relax. And once you feel like you can fall back asleep, then go back in bed.
Ah, that sounds counter to what I've heard.
Mm.
I've always heard that you should stay in bed, try to relax, don't try to, make yourself more awake or alert. Ah, I see. Okay.
So it's kind of like, when somebody's upset, when you tell them, come on, relax, it actually upsets the
It doesn't
people.
work. Yeah.
Yeah. So, and when somebody's stressed out, when you tell them like, oh, don't stress out, like, okay, what do you mean don't stress out? I'm going to be stressed out more. So it's kind of like that similar concept. So, so when you start to come out of bed, so it's kind of like, training your body or training your brain. So, as soon as you're not feeling sleepy, you come out of bed and then you only go back to bed when you're ready to sleep. It reminds your body like, oh, okay, bed is a place for sleep only, not for worrying, not for stressing out.
Right.
Yeah, so and also I use this comparison or after listening to a podcast from a American Academy of Sleep Medicine, but um I would say treat sleep like a cat. Okay. So I don't know if a lot of people have cats or like pets in their households, but Normally, you can't really force cat to do anything. You try to cuddle it, and when it doesn't
Right.
want to, it'll scratch you and it'll run away. Same
Right.
with sleep. So you can force your body to do many things, but sleep is not one of them. Sleep, you just have to wait for it to come.
Ah,
Yeah,
okay.
yeah. So and you have to make sure that you're essentially you're when you're coming out of bed and doing something relaxing, you're just waiting for sleep to come back. Kind of like you're waiting for the cat to come back.
Yeah, almost seems a little counterintuitive, but I think as with anything, you probably need to put it into practice. So that also becomes a habit, right? Yeah.
And also, one of the other concerns that a lot of my patients worry about is they're not going to have enough sleep when they come out of bed and they're not sleeping rest of the night. Uh,
Hmm.
but when you kind of think about it, when you're struggling to sleep during that time, you're not sleeping anyway.
Hmm.
Yeah. So
Okay.
why spend that time struggling?
Right.
You can spend that time doing something relaxing. And one thing to that you can look forward to is, okay, you're sleep deprived the night before. You're exhausted. You're going to be very tired, which means that the following night you might be able to get a little bit more sleep because you are so tired.
Ah, okay. Yeah.
Yeah.
What are the long-term? I'm always worried about the long-term complications of poor sleep and the cumulative effects of that.
Mm,
You know, you know,
yeah.
we aren't always able, we try to control so many aspects of our health
Mhm.
just to ensure the best outcomes. But what are some of the negative outcomes associated with poor sleep besides the ones that we've already spoken about?
Right. So, sleep is really vital to health. So, in addition to memory, cognition, increasing risk of dementia, it can also affect your risk of having higher blood pressure, coronary artery disease. Also, if you're very tired and sleepy and not able to focus, there's a chance that you might get into an accident
Yeah.
or also, you won't be able to focus at work, so it can affect your work performance. So it can affect other health aspects such as diabetes. It can affect your risk of having higher glucose levels.
Mm.
Also, there's been some concerns about whether poor sleep can worsen your risk of having cancer, etc. So it really affects your health in multiple ways.
Yeah, and I think maybe the Cancer Association is just that poor sleep just increases systemic stress.
Stress,
With
systemic,
the
yeah.
right, and so with the chronic unmanaged stress, that in
Mhm,
and of itself is a risk factor for malignancy and cancers. So
mhm.
maybe that's where that association comes from.
Yeah.
I have actually known you, Dr. Chang, since medical school. We both went to Albert Einstein, and we didn't get much sleep when we were medical students. I'm actually just thinking about this. I've known you probably for about 24, 25 years, if my
Ah,
math is correct. And I
yeah.
think about our days of being in medical school together, and the nights weren't always sleepless, but
Mhm,
we spent so many hours studying for examinations
mhm,
and working in the anatomy lab and doing all those other, all the things it takes to, complete medical school.
mhm,
And I remember I heard on a podcast recently that we almost have to change society's perception of sleep.
mhm,
People who don't need a lot of sleep or people who don't sleep that many hours per night, it's almost, they get a lot of bragging rights from that. And then those of us who need a little bit more sleep, we don't feel that we should, confess because it's not seen as, something to really brag about. But I think we really have to kind of change the dialogue surrounding, the importance of sleep. And as you mentioned, how incredibly vital sleep is. So I think we
exactly.
really have to, make some strides in terms of changing the narrative.
Yes,
Um,
absolutely.
I have
Uh,
heard mixed reviews about melatonin. So I
mhm.
remember many, many years ago, people were taking melatonin, but then I've heard more recently that melatonin is not the most effective and probably not completely safe. what are your thoughts about melatonin, or what are the studies showing about melatonin?
Yeah, so melatonin is a hormone that gets naturally produced by your body. A lot of many people take it as a supplement, as a sleep aid. There has been some mixed response from patients about yes, it works, no, it doesn't. So, in terms of as a what we call a hypnotic, that's a specific term for sleeping medication, sleep medication. It's not a very good sleep medication.
Mm.
But it really depends on what's driving the trouble sleeping. So let's say if you're having trouble sleeping because you're a night owl and you need a little bit of that extra melatonin to help you fall asleep, then it might work okay. But if you are having trouble sleeping because of other issues like stress or anxiety or pain, etc., then melatonin doesn't work very well. So to give you a little bit of a clarification, melatonin is a hormone that controls or signals your body that, hey, it's time to sleep. So it's priming your body to get ready for sleep, but it doesn't actually make you fall asleep. So it's a very subtle difference there.
Right,
Yeah, so and I know a lot of the commercial formulations, it can vary anywhere from 2 milligrams or some of them have 20 milligrams. But there hasn't been really a lot of data on the safety profile of the melatonin and also the
right.
long-term consequences of it.
Mm.
Also, the problem is that since it's considered a supplement, it doesn't quite have a very good FDA regulation.
Right, right.
Each bottle you get, it might say that, hey, you're getting 3 milligrams, but if you might not be getting the 3 milligrams that the bottle says you are getting.
But not regulated.
Exactly. And
Okay.
also, even within the bottle, some pills might contain 1 milligram, some pill might contain 5 milligrams. So there isn't really a regulation.
Ay, ay, ay.
Yes.
That's true. I think a lot of us don't really think of it as being a supplement.
Yeah.
Right. Interesting.
So
Um,
yeah, so it can help in certain situations.
right,
I wouldn't, I mean, some of the doses that are out there, like up to 10 milligrams, I wouldn't really go that high. And
right.
you might be able to try maybe 3 milligrams or 5 milligrams if you really, really want to, but definitely talk with your doctor before taking it chronically.
Yeah, and there was also a recent report about how it can negatively interact with other medications,
Hmm.
and can potentially like skew lab results. There was something about like interference with different lab results in patients who were taking melatonin, and it was potentially causing inaccurate lab results. But
Right, right.
Um, one thing that you mentioned to me that I was not aware of, which I think is really pertinent in kind of today's society, especially with recent legalization of marijuana, that marijuana can actually affect sleep.
Yes.
Okay, I didn't know.
So marijuana, a lot of the times, at least where I am in Washington, it is legal. So a lot of patients use it, or relatively more patients use it compared to the rest of the country. So it can affect sleep in certain ways. And more research is being done. But sometimes depending on what type of marijuana or how you're using marijuana, it can affect your sleep. So
Okay,
in terms of how it affects your sleep architecture, it can potentially suppress your what's called the REM sleep, rapid eye movement sleep. I mean, when you're sleeping, your brain goes through different sleep stages, like shallow sleep, deeper sleep, and rapid eye movement sleep. And there are more studies coming out that the marijuana can actually suppress your REM sleep. So that tends to be your dream sleep. And a
okay.
lot of the times your memory consolidation happens in dream sleep.
Uh,
So when you're suppressing that, then it can potentially long term can affect your memory.
hmm,
Also, depending on how you're using marijuana. So if you're smoking it, for example, then that smoke can also affect your upper airway. So you might be getting swelling in your upper airway because of the smoke. And if you're already at a risk of having snoring or sleep apnea, that can actually worsen that. So it can affect it that way as well.
Very interesting. I did not know that. One other major cause of poor sleep is perimenopause and menopause, not only because, the risk of night sweats is a little bit higher in those, age brackets, but I think just with hormonal changes, which then leads to the night sweats, but I think with hormonal changes in general, that, sleep disturbance can occur in the perimenopausal and menopausal areas. Can you speak a little bit about that?
So yes, absolutely. Yeah, I do get a lot of patients, well, a lot of women patients who are going through perimenopause, postmenopausal stage in their lives, and they come in because they all of a sudden they are not able to sleep very well. And so, like you said, it can be related to the night sweats, but also the hormonal changes themselves can really disrupt the sleep.
Right.
And also, many times when women go through perimenopausal state, their metabolism changes and their body composition changes as well as their weight.
Wow.
So when you tend to have, one of the most common comments I get is, patients would have the same amount of diet, maybe exercising even more, but they're still gaining weight and they're not able to lose those few pounds, or they're constantly gaining weight. And all of a sudden they're snoring what they didn't before, and they're having sleep apnea symptoms. So in addition to the hormonal changes, the insomnia symptoms, like one of the risks of hitting menopause or middle age is developing sleep apnea.
Oh, really? Just because of the hormonal changes?
Mm.
Uh-oh.
Yeah.
And what is the recent data about like black cohosh and primrose oil or supplements for management of like perimenopause and menopause? Is there any new data that shows that they work, or are we still running into the same issue of unregulation and we don't have like a fixed dose that works, or because I think people are,
Yeah.
and or is it just, the consideration of hormone replacement therapy?
Yeah, so yeah, that part I'm not at all I am not too
It
familiar
could be
with
like a
controlling
whole
the
different
menopausal
conversation.
symptoms. Yeah.
Yeah. And
Yeah.
actually, that's one of the topics that we plan to dive into in more detail as a part of this conversation series, just talking a little bit more about perimenopause and menopause. So we'll bring you
Oh yes.
back to that episode. All right. One thing that you also told me about, which was interesting to hear, just to make these, make ourselves feel more empowered in terms of managing our sleeping issues, is that we can keep a worry journal.
Yes,
I thought
yes.
that was such a good idea. We have journals for so many other things, travel and wellness and, self-care. So I thought
Right.
the idea of a worry journal, especially if you find that worry is something that's preventing you from having adequate amounts of sleep, was such a great idea.
Yes, thank you. Yeah, so I wish I could get the credit, but it's one of the techniques that can be used or that is being used when patients have what's called a cognitive behavioral therapy specifically for insomnia, and I can touch upon that more in a little bit. But yes, many times when you're having trouble sleeping at night, usually it's dark, it's quiet, and now you finally have time to sit down and think. And so you're thinking about 10,000 things. You're worrying about things. Are planning out 10,000 things that needs to be done tomorrow. And many times when you're ruminating over those contents tend to expand, or you keep on thinking about it over and over again. And before you know it, you're in bed for 2 hours thinking about that.
Yeah,
Many times when you actually write those down, it not typing it up on a computer, don't put it on your phone, but actually getting a piece of paper and writing it down with a pen or a pencil. It really works great in transferring those thoughts outside of your brain to a piece of paper. And you might actually or you might have thought that you were thinking about 100 things, but when you actually write it down, it might actually be about like 40 things that you were keep on thinking over again.
right.
And So after you write it down, when you get back to bed and try to fall back asleep and you're finding yourself thinking about it again, you can always tell yourself like, "Hey, I wrote it down. It's here. I'll just think about it tomorrow. I'll deal with it tomorrow." And so it helps with that.
Right. Just to kind of transfer the worry onto a piece of paper and have that little bit of separation,
Exactly.
or literally like taking some action.
Exactly.
Um, it makes you feel more empowered. So it's a positive action step. Yeah. Yeah.
Absolutely.
I feel like we talk so much about action plans. So I feel like the worry journal is a good way to kind of implement the action plan to make us feel more empowered.
Right. And also when you write down about what's worrying you, you can also write about, oh, what are your hopes or how can I fix this situation or what's kind of verbalizing or actually writing down what's actually worrying you. It's actually really empowering.
Absolutely. So I think we shouldn't like minimize, the impact of doing those seemingly small things, but those very small changes can actually have very big impacts.
Exactly.
So we're coming towards the end. So I just wanted you to kind of wrap up, in terms of when should someone really seek medical attention? As you mentioned before, unfortunately, sometimes different disease states can present differently in women than in men. I know that has been well established in terms of heart attacks. Women present differently. They don't always have the typical crushing chest pain that sometimes men have. And as you mentioned earlier this afternoon, sleep apnea can also present differently in women as compared to men.
Yes.
But in terms of all of the sleep abnormalities that we've spoken about so far, when should people get concerned enough that they seek medical attention? What
Yes.
are
So
the red flags that we should be looking for?
yes. So if you're having trouble falling asleep, staying asleep, or waking up too early, and you try all the sleep hygiene techniques, so minimizing any stimulation during nights, or where you're not staying forcing yourself to sleep at night, but you're still having trouble sleeping, and it's starting to affect how you're feeling during the day, then I would say definitely talk to your doctor about it. Also, if you're getting so tired and you're dozing when you shouldn't be. So if you're finding yourself falling asleep at work or dozing, or especially if you're dozing while you're driving, if that is the case, definitely talk to your doctor about it.
Yeah,
Because those are really, really dangerous signs that there's something going on with your sleep.
absolutely. Do your patients ever bring in their sleep tracking data for you to analyze?
Always. Many, many, many days,
You,
many
do
times.
you recommend, so these are apps on a phone or is it something on your mattress? How are they monitoring sleep?
Oh, there are so many sleep tracking devices out there nowadays. There are ring forms, there are watch forms, apps on the phone, mattresses, pillows. There are a lot of them out there. I mean, some seems to track sleep data a little bit better than others. But I mean, it's still the technology is getting better, but it's not perfect. So, some of them might tell you like, oh, you're getting 10% of deep sleep and you need 20% of deep sleep. And so it can cause some worries in a lot of patients who are using it and they realize, oh, my sleep quality is bad according to this device. So
Ah,
I recommend my patients usually to use those data as as to trend your sleep, not as a diagnostic tool. So if the device tells you like, oh yeah, you're getting bad sleep, but you wake up, you feel rested, then you actually got good sleep. But if you're
despite what the data showed.
exactly. So, but if let's say when the data shows you got poor sleep, you feel poor the next day, or you feel poorly the next day, and then the nights where the trend shows like, oh yeah, you got pretty good hours of sleep or pretty good quality of sleep, and then you actually feel good, then you can kind of use that to track that because those smart devices many times also track your other aspects of your life, like how much sunlight you got, how much exercise you did, what kind of diet were you following, etc.
And these are subscriptions? Or the
Some of them are subscriptions. Some of them come with like the smartwatches themselves.
Okay.
And I think two of the bigger watch makers, smartwatch makers, there's some data about them being used to diagnose or alert somebody for sleep apnea. That's actually one of the newer developments in the field. So
Okay.
if your watch tells you like, oh yeah, you might have sleep apnea or you're not breathing right, it would be good to talk to your doctor about. But when it tells you, oh, your sleep quality is good or bad, I would take that as a grain of salt.
Okay. So use it as supplemental information, not as a diagnostic tool.
Exactly. The diagnosis can only happen in by a sleep study. So that one you would really have to talk to your doctor about.
Okay.
Um, Also, on the flip side, let's say you're having all the symptoms of sleep disorders, or you're having all those symptoms, but the watch is telling you or the device is telling you you're getting good sleep. If you're not sleeping well, regardless of what the device is telling you, get evaluated.
Right. Right.
Mhm.
Very, very great tips and pearls. Do you have any, like, can you give us like one takeaway, or is there anything else that you'd like to say, or anything that we haven't discussed so far that you think would be relevant to share here on this
Yes.
very important topic? Any last Sandman secrets?
Yes,
Love
so
that
I'm
title. I love that title, by the way. That was so creative.
thank you. Yeah, so I mean, sleep is absolutely important, and like you mentioned before, we're overall the society view of sleep wise, it's transitioning from oh we can sleep when enough when we're dead to like oh sleep is very important. So
Yes.
so it's I am very happy and honored to be invited to be able to talk about the importance of sleep with you today. And yeah, I would say sleep is important, but I wouldn't force it if you're not able to do so.
Right.
And but if you are noticing any abnormalities in your sleep, your sleep quality is not good, and you're feeling really tired, then it definitely talk to your doctor about it. And a lot of the times, the primary care doctors, they are a lot more aware of the sleep disorders that can affect patients, and they would be able to refer you to a sleep specialist if needed.
Right. And I think what I've actually taken from you today, as far as it pertains to my own sleep hygiene, is that I'm definitely going to keep a worry journal. So maybe when I wake up at 4 a.m., I'll just get my worry journal and just make a few jottings there, or I'll listen to some nice soothing music. You
Mhm.
know,
Yes.
sometimes I listen to some music in the background just as white noise. Those are some good takeaways and tips that I can implement in my own routine just to try to optimize my sleep hygiene. And I think one other thing I heard was, you don't necessarily have to change your mattress, but at least rotate your mattress. So I think sometimes we also forget that, we have to make sure the bed is actually comfortable. And you don't
Yes.
have to actually go out and buy a whole new mattress if you don't have to or can't afford to, but just rotating the mattress every once in a while. I don't know the frequency, but that can also be helpful.
Yeah, absolutely. You don't want to be in pain. You want to
You don't
make
want to
sure
be in pain.
you're comfortable when you're sleeping. Yes.
Right, right. All right, so I think we'll end here. For our audience members, please feel free to leave comments below and we'll respond to them. I will be in touch with Dr. Chang following today's discussion, and I'll get back to you with her responses to your questions. So please feel free to leave your questions. And we'll probably have to do another part of this, Yoonhee. I don't think we can tackle all things sleep in one conversation, but I
Oh,
think this was a good start, and I'm so excited to have
thank
you as
you.
our first guest.
Thank you so much. This was so much fun. Yeah, and yes, definitely. I would be more than happy to come back for more.
Yes, and it was amazing. Please say hi to your lovely mom. She always cooked really nice food for me. I'll never forget that Thanksgiving when we during residency when we got to come over to your house and she made that like
Yes, she made
salmon.
a.
She made like smoked salmon. It was delicious. So please say hi to your
Thank
mom for
you.
me.
Same to you. Please say hi to your mom.
I will. And enjoy the rest of your Sunday.
Thank you. You too. And
And it's a
keep
little early to say sweet dreams, but we're going to say sweet dreams
your
anyway.
dreams. Yes.
Right,
Yes, yes,
Dr.
Craig.
Chang, thank you so much for joining us again. And on behalf of the organization, we're very grateful for your time. Dr. Grant, thank you so much for hosting. Again, continue to our online viewers, like, subscribe to our channel. There'll be more coming, more community conversations. We'll talk more like about real estate, finance, health, so much more that, we're going to bring to the table. So please stay tuned. All right. Have a good evening, everyone.
Thank you, Craig. Thank you, Yoon Hee.
Thank you, Tanisha. Thank you, Craig.
All right.
Bye-bye.
Have a good day.